Hello everybody, I'm Dan Irvine, Senior Director for Operations for Health and Nutrition in the Sustainable Health Department. It's a great pleasure to have a few minutes to speak with you today through this video around the importance of advocacy in our health and nutrition work. I have three key messages to share with you in this short video. The first is that advocacy has clearly demonstrated to have a deep impact on the health and nutrition of mothers and children with whom we work. We have an increasing evidence base coming from our Citizen Voice and Action programming locally, as well as our Child Health Now initiatives nationally and globally. And we have seen very clearly that through improving policies, by holding duty bearers accountable for their resource allocation commitments, by focusing on health system strengthening in general, that we are saving more lives of mothers and children in the countries where we're working. Secondly, I want to be very clear that from the perspective of the Sustainable Health Department, we consider advocacy to be a core, cross-cutting, foundational intervention in all of our health and nutrition programs. This means that we expect to see advocacy built into the program designs in every country that has prioritized health and nutrition in their strategies. And thirdly, we can realize our advocacy objectives better through incorporation of the advocacy consideration into our technical approach development process. How does this happen? First, in our assessment process, we need to be very careful to be sure to look at not only what is happening at the local level, but what is happening throughout the system at district, regional, and national levels as well. And I would remind you that World Vision has a theory of change which now requires us to assess and design at each of those levels, not just at the local level, but up through to the national level as well, because we've come to the understanding that develop doesn't happen in isolation at the local level, that what happens there is highly dependent on the systems level issues occurring in those environmental spheres that I've just been describing. So the assessments need critically to look at what the policy structure is nationally, what the resource allocations look like in our resources, in fact, reaching down to the community level the way that they need to deliver services to the beneficiaries. Are commodities being delivered? Does the information management system function correctly? Is the health governance effective and in place? Do they have the requisite staffing capacities that they need? And if they don't, then in our design work, critically, we need to prioritize activities in which we partner with the ministries of health and other partners to strengthen that health system, again, from the family household level up to the national level. So assessment, design, and then in our technical approach process, we need to look at resource allocation and ensure that where we have prioritized activities at each level, that there are adequate resources in place, both financial and in terms of human resources, to support the effective implementation of those activities. And finally, that our log frames and our hierarchies of objectives explicitly include our advocacy outputs and outcomes at each of those levels again, and that we are able to effectively monitor and evaluate our work against those specific advocacy objectives as we've established them for us. So again, the three key messages are, one, that we have very clearly demonstrated and seen that advocacy has a deep impact on saving mothers and child's lives, reducing nutrition, reducing disease burdens, improving their health in general. Secondly, that the Sustainable Health Department considers advocacy to be a core foundational intervention across our programming everywhere where we work. And thirdly, that the advocacy perspective needs to be built into every stage of our technical approach development process. And for that to be successful, we need to bring our advocacy colleagues into that process to represent that agenda very specifically. I hope this is helpful for you. I hope that I've been able to make clear our intention with advocacy in our health and nutrition program design and our aspirations, and I wish you all the best for your conference and discussions. Thank you.